Diane and Gemma, How Does It Feel for Me? July 2025, Part 2. In this video, 3 services are mentioned: BID services, Patches, and Leeds Mental Wellbeing Service. BID services supports people of all ages with sensory loss, as well as their family and support networks, to access information, advice, and support. Patches is an online service for non-urgent GP communication, such as requesting an appointment, ordering repeat prescriptions, and more. Leeds Mental Wellbeing Service is an NHS-funded service for adults 17 plus, providing free support and psychological therapies for mental health difficulties. How have services communicated with you since we last spoke?
I received a letter, opened it, and it said I had an appointment later. I felt something was wrong, so I reread it and realised the date was wrong. It said April earlier this year. What's it talking about?
The letter doesn't really make any sense as well, because it's inviting her for a clinical photography appointment for IFR. I have no idea what IFR is. My mum has no idea what IFR is. It's a bit sort of unclear what the appointment's about. I'm assuming it's to do with the eye clinic and getting photos of her cataracts, but no idea from this letter. It doesn't say anything about that. And then the only way to contact to reschedule the appointment is by telephone, so that means I've got to do that. There's nothing on there for my mum to contact. There's a handwritten note to say feel free to bring a friend or family member with you to interpret or sign. Unfortunately, our department is unable to offer this service, and it seems so silly that they were able to handwrite that but not able to book an interpreter and not able to see on the system when it flags up that my mum's deaf and cannot contact about this appointment by telephone. It kind of is stressful because it's like you're sort of going into a health appointment and you don't really know what to expect, and as a family member you don't necessarily want to be involved in all that kind of stuff.
Can you tell us about how your health is at the moment?
At the moment, the problem is with my leg. It's painful. It's hard for me to stand up because of the arthritis. Doctors said they can't do anything, but will provide tablets.
She was told when she was first diagnosed as diabetes she can't have any pain relief because they're all sugar coated, and then in the last appointment she was told, oh, she can actually have paracetamol. She could have actually had something this entire time. So whenever she's been hurt, she's just sort of stuck through the pain. In the last appointment, it was quite unbearable for her, so they've prescribed her codeine. After the last sort of update, my mum wasn't feeling too well, so I called up the GP. Then they said, oh, can you go onto Patches then and make a request through there? My mum didn't have a Patches account and she wouldn't know how to set one up. And I sort of set one up on her behalf, went to go make an appointment on there, and then it said that it's closed, like Patches is closed for this practice because there's no appointments available on that day. So I ended up calling the practice back and they were like, oh, you can do it, you can go on at like 8 o'clock in the morning. They even said through Patches they may not necessarily check it and keep on top of it either. So I'm like, well, why are you telling me to use that? It's not very reassuring. My parents just sort of don't have independence because the services just aren't made accessible. Like receiving a letter that says I have to call up, Patches not being an efficient system to actually get an appointment. It all just ends up relying on phone calls and me having to be there.
Gemma, you and your sister Georgina have been involved in your dad's care. How has this felt for you both?
So my dad is now accessing Leeds Mental Wellbeing Service. He had his initial appointment. They called me to book that and they made sure that there was an interpreter there, so that he could just sort of go on his own and, you know, talk about his mental health without me present. And they called my sister and they tried to arrange an appointment for her, and she was really thrown by it. She was like, why are you contacting me for the appointment? Surely you should contact my dad directly. And they had his email address. After that initial call, they emailed my dad to sort of arrange an appointment, but his English isn't the best, so he wanted assistance with that. So my sister then sort of came back over to sort of help him draft an email, and this sent a response, and then waited a few days, didn't receive any response. So then my sister called them to try and get a response, and it turns out that the admin person who manages the emails was away, and so it wasn't being managed properly. My dad eventually got a response. There was no date or time or location in the email, so he's still waiting to find out when his appointment is.
What have you valued most since we last spoke?
BID has just been really helpful for me. Like, before contacting them in adult social care, I really sort of struggled managing a lot of things with my parents. You know, there was a lot of like additional contacts that I had to make. My parents weren't, aware or using any of these apps, and they also offered loads of extra stuff as well. Like, I was concerned about my mum not getting out of the house and things, and they run groups and offered to pick my mum up and bring her to those groups. So like, they've just sort of been really positive and sort of supportive for me as well as my mum.
Yes, BID are good. They have supported me a lot. They came and helped me use the phone.
Thank you to Diane and Gemma for sharing their story. Produced by Healthwatch Leeds in collaboration with Ro Lara.